Coming up in today's show, America's Healthcare Advocate, we're going to be talking with John Kuhlmann from Kuhlmann Group, as well as Lauren Broyles and Josh Bowman, his associates that work at Kuhlmann Group with them. If you've ever wondered, how would my association get health benefits? How would that work? Or maybe you've got a large group plan and you'd like to figure out a better way to handle your health insurance benefits. You can do that by talking with these folks. But most importantly, listen and learn today as we talk about how an association can actually offer health benefits, especially if you've got 1099 employees.
And now, America's Healthcare Advocate, Carrie Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. My producers today, Mr. Garner Cowdery behind the microphones and Mr. David Thiessen behind all the cameras, the man who posts all these shows up on our podcast and YouTube channel. By the way, 608,000 views now, thanks to all of you out there in the listening audience on the podcast channels, all 16 of them in our YouTube channel. And we have a new affiliate. We'll talk about that a little later on in the show. If you have issues, if you have questions, if you need help with something, you can go to the website, americashealthcareadvocate.com, americashealthcareadvocate.com. Send me an email. Yes, I get a lot of them, but yes, I answer each and every one of them. So feel free to send me an email if you need help with something. We're happy to help you. In the studio with me again today, John Kuhlmann, CEO of Kuhlmann Group. And you brought a few associates today.
I did.
All right, so we have Lauren Broyles, who is your vice president, director of operations. And I have Josh Bowman, who is also with a financial advisor with Kuhlmann Group. So welcome, all three of you. Happy to have you here. You're an old pro at this now.
Thanks, Gary. Yeah, I've been doing it since 1991. So a long time. That's when I started my firm.
Yes, so let's talk a little bit about that, because what you do is a little different than what I see out there with a lot of brokers. What you do, I think you kind of specialize in this association management, association health benefits, and all the other things that go with association management. Right. So it's a different corridor. We're working with you with the gig care program and some of our other programs on that for 1099 and self-employed. But let's talk about how you got into that and what you do there that makes you so different than everybody else, because I've been doing this for 23 years, and the first person I ever ran across that does this like you do.
Thanks, Gary. So in 2019, we started working with one of our clients, and we basically saved them $1.4 million just on their health insurance and another $120,000 on their ancillary coverages. And at the time, they were with the 13th largest consulting firm in the country. And they had been with them for years. And the line that they gave them on every renewal was, well, medical trends running around 8 or 9%. So it's a fair increase. You should just take it. And they don't even really shop the group out. And when they do, they don't really do an adequate job. And that's pretty much what we see on most groups that we work on. So we don't take that approach. We actually go to market on every line of coverage with every carrier. And there's a big reason for that. There's a lot of value in the TPAs that we go to. TPAs stand for third-party administrators, whereas you hear about the BUCAs. Those are all the big publicly traded insurance companies. So their motivations are different than the TPAs. The TPAs are privately owned. And because they're privately owned, their whole focus and goal is to drive the most affordable health care with the best benefits possible to the members. So for this client, not only did we save them the $1.4 million on their health and $120,000 on their ancillary, but we also improved all those benefits. The next thing is that after we did that, the CEO shared with us that he has an association, and at the time they had over 3,000 dues-paying members. Before we were in the picture, they had over 3,000 dues-paying members. When we came into the picture, they had shrunk down to 850 dues-paying members. So they were like, do you think you could do this for our customers and help them? Because it would create a lot of goodwill for our customers and help us help our customers. And said, absolutely. So we did that. And about 2.5 years later, they're back up to about 3,500 dues-paying members, which is tremendous growth for the association. We're not the only reason why that happened. Their executive director was a big part of why that happened too. But with our programs and that are very comprehensive, we helped basically do that. And we, in turn, have also saved a lot of their clients 5 figures on their benefits also.
You know, if you're listening to this and you're wondering, maybe you're a member of an association, maybe you're just a member of an association, maybe you're a director, maybe you're a CEO, or maybe you're someone thinking about what you want to do, and we'd like to have an association, but we'd like to talk about maybe we can do health benefits. Well, there are a lot of hoops you have to go through, and there are certain ways this has to be done. And what you need is a knowledgeable expert. And that's what Kuhlmann Group is. And that's what I'm listening to you. That's what you're demonstrating to the audience. That's why I wanted to do this show today. There's a lot of need in the marketplace right now, especially when we talk about the 1099 self-employed space. We'll get into that a little later in the show. But the idea of innovation, that's what Kuhlmann Group brings to this. And if you are in an association, you don't have benefits for health care. These are the folks you want to talk to because that's what they do. So talk about, you've got a pretty long list of everything you do here. I was doing show prep about 4:30 this morning.
Right, early.
Wrapping up. And I worked on this yesterday as well. But the point is, I'm seeing everything on here from critical illness to financial advisory to payroll to individual voluntary benefits. And it goes down the list. I'm guessing, Lauren, you probably have a lot to do with how all that happens.
Yeah,
it actually does the work, if I had to guess.
Yeah, so I actually talk with a lot of the customers, and to speak on the association John was talking about, a lot of the members, they're little mom and pop shops. So this has brought a solution to those mom and pop shops where they don't know where to turn, where it might just be a husband spouse group and they need access to benefits. So this has been a huge, basically solution to them to get needs met for their employees and put benefits in place.
So John, that's interesting. Lauren brings it up because the most underserved, everybody wants to do the 500,000 life case.
And we do that too.
Oh, yeah, I know. Yeah. But it's the 1 to 50s that in this marketplace are getting killed with these huge increases. You've talked about this before that are coming across on the ACA type plans, all the rest of it. And as Lauren said, it's a mom and pop shop. Maybe they've got, I'm a 27-year recovering broker. Okay. Right. And I remember going into places where there'd be 10, 11, 12 employees, and they're getting killed on cost. Right. One of the things that you're doing with your association management is bringing them solutions like that. So talk a little bit about that. I know you're doing the gig care program, consumer data respondents with the folks with our company, Population Science Management out of Nebraska. But talk about, Lauren just mentioned that, giving them access to something they can't find in the marketplace that you're doing.
Right. So on all size groups, basically what we bring to the table is a full array of benefits. And on anything we do, we make sure that we check all of the options that any client could have for everything. So when you look at these smaller companies, many of them can't even afford to provide health insurance to their members. That's why we brought in the gig care solution, the 1099, right? You also get some employers, what we found is a lot of employers are outsourcing their IT because the IT doesn't want to be an employee. They want to work for other companies and help multiple companies. But some employers want to be able to cover those 1099 people. So we have two solutions for that. We have the gig care, but we also have, in particular, one TPA that will literally allow you to cover 1099 people in addition to your regular W-2 people. It's really a wonderful program. It's probably the best healthcare program out there for groups. It's not probably, it is. So we have a lot of groups that we've been able to put with them and literally not have their rates change in 3 years. And actually, we just had one of our larger groups with 600 employees. In their third year of no increase, their rates actually went down in their third year, and their benefits stayed the same. So it's really powerful stuff. In addition to that, they bring powerful solutions to the table for PBMs.
Pharmacy benefit managers?
Yes.
Okay.
Yeah. So the prescription drug side of their plans, basically, they do some great innovative stuff on that, just like gig care does on its pharmacy side for its individual members. They basically are able to get the drugs that are name brand drugs for individuals, high cost drugs typically, at no cost or low cost for the member. Whereas if you're with one of the large insurance carriers, basically you're usually paying your out-of-pocket max for it.
Yeah, you are. Your co-insurance and maybe some of the deductible depending on the plan. So when we come back from the break, we're going to talk more about this. And then in the third segment, we're going to talk about how Kuhlmann Group actually offers financial planning help to a lot of its members as well. And Josh will talk about that. If you want information, maybe you're curious about how do they do this, or maybe you've got an association or a co-op or whatever the case may be, and you're looking for a solution, or you'd like something that would help them members, like was just described by what John talked about. 314-494-7860. Anywhere in the country, they're happy to help you. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting coast to coast across the USA. Don't go anywhere. We've got more. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HI Radio Network. You can find out more about us by going to the website, All the information is up there. Shows are also posted there on all 16 podcast platforms and our YouTube platform. I want to welcome our newest affiliate in the Ozark Mountains, KWPM AM and FM 105.1 in West Plains, Missouri. We want to thank Jim Lambert. He is the station manager putting us on the air, and welcome them to the America's Healthcare Advocate family. We're happy to be on up in the mountains in the Ozarks. Thank you for joining America's Healthcare Advocate. John, let's talk a little bit more about what's interesting to me is that you guys look for solutions that other people just don't seem to take the time to look for. You made that comment about brokers. Brokers go in and show the spreadsheet and say, pick the least evil on the spreadsheet, as opposed to the way you're doing it, which is, here are the problems, what are your needs, and how do we find a solution?
Right. So one of the things is we have a true passion for what we do, and we outwork everybody. And we don't come back and tell any client ever, hey, you just got a 10% increase in medical inflation's running around 9 to 10%, so you should just take it because it's fair. You'll never hear that from us. As a matter of fact, even if our groups get a rate decrease on the renewal, that happens sometimes, it's rare, we still shop them out. And the reason for it, it's the second or third most expensive line item that any company has. And for a few companies, it might even be the most expensive line item.
Absolutely.
So we always make sure we do that. And we do that on every line of coverage, because basically what we found is even on the ancillary, most brokers do what's best for them, not what's best for the client. And why I'm bringing that up is, as a consultant, we know that the health insurance drives the relationship between the client and the broker and the consultant. So unfortunately for most folks, once they pick the health insurance, the broker just puts them with who usually is best for them. And we don't do that. We shop everybody on the ancillary like we do on the health insurance side. And then we also add in a Ben admin system and basically help the employees with an enrollment platform. And we automate all that with the payroll so that there's less administrative work to do. Lauren handles that for us with our clients on a regular basis. So
talk about that, Lauren. How do you handle that? And I noticed when I was going through all the materials, you're doing everything from payroll. We're going to talk about financial planning in the next segment. All the other things that you do, critical illness, Clever RX, tailored 1099 contractors. Talk about how all that works.
Yeah, so I handle the administration side. So I'm everywhere from the implementation to the service. So my job on customer service is to make your HR team's life easier. We service all size groups, so maybe your lack of HR team. So I help make sure that everything's streamless from your payroll to the benefits to the carrier side. So like John was speaking on, we still have some people that we come across that are still using paper enrollment forms to enroll their employees at renewal time, which is just insane. There's so many solutions out there. We like to put in Ben admin systems. It makes the HR team's life easier because things are automatic. When you leave things up to paper or in a person's hands, there can be, human error when that happens. So making it more streamless so it's on EDI connections eliminates errors that can occur.
We had Kenny Delco on a couple of times and talked about what you're doing with NHRA, an association you're working with, National Hot Rod Association. Kenny has a saying that he does as part of the gig care discussion. It said, a company built for hardworking Americans. And you have a saying that we're Main Street. We're not servicing Wall Street. What does that mean?
Yeah, so we always share with folks that we're all about Main Street, not about Wall Street. And what we mean by that is a lot of the bigger consulting firms, they literally are working with the big carriers.
The BUCA carriers.
Yeah. Most of them publicly traded.
Yeah.
And like on prescription drugs, some of them even get cuts off all the prescription drugs that the member take. When they're already overpaying, they're getting the rebates. So a lot of the privately owned TPAs, third-party administrators that we work with, they'll literally cut the rebates out of the plan and get the drug to the member at either low cost or no cost, helping the member, also dramatically lowering the cost of the drug. You take a drug like Humira, it's about $8,000 a month.
Yep.
A lot of the bigger carriers will tell you that it'll only cost you $4,500 to $5,000 a month for the drug. And they're right, if you go through them.
Yeah.
What they don't tell you is that they're getting a rebate of about $2,500 a month on that drug.
That's correct.
And they're putting every month on every member on the drug.
Yeah.
It's insane. So the TPAs we work with, they cut all that out, and they either get the rebate eliminated to lower the cost of the drug by the cost of the rebate, or if the pharmaceutical company insists on paying the rebate, they put it back in the client's claim bucket typically.
Or like Tego, who you work with, our company, Tego Health, our TPA, we have our own program called ScriptDate, and we just import the stuff.
Right.
And if you're taking Humira and we're importing it, you're going to pay a lot less than what you're going to pay through any of the major carriers. That's for sure. I don't think a lot of the public really understands this. And it's understandable. This is not, look, healthcare is confusing as hell. Okay. Believe me. As I said, I've been doing this 27 years. It's not an easy topic for people to wrap their head around. But what you're hearing is, when you want to do something like this, you need an expert, and that's what these people are. And what you're talking about is solutions that are out of the box.
Right.
Okay. And they take work.
Right. A lot of work.
Yeah.
But we put it in.
Yeah.
We just won a group of 100, and there was 2 other firms that we were up against, and a new client for us. We picked them up, and their existing consultant had been with them for around 35 years.
That's a long time.
And we replaced them and saved the group basically well over 6 figures just on their medical. So we're going to be bringing other great solutions in to automate things and make them more efficient, improve things too. But we really do try to bring a whole package approach to everything we do related to benefits. So another big area that we run into is people on their payroll. So we don't sell payroll, but we have some very good partners on that are literally technology companies that do payroll. They dramatically lower the cost of the payroll, and they significantly improve and make it more automated. And then that ties back into the Ben admin system that Lauren was talking about. To give you an idea, we have a group of 100 in the state of Washington. Just on their payroll, we saved them $480,000.
That's insane.
Yeah, we saved them close to another $100,000 on their medical, and then we saved them about 20 grand, maybe 25 grand on their 401k.
Those are all the things that contribute to making a difference, and that is critically important. Unfortunately, in today's world, as you talked about, a lot of the big houses, the big brokers, the big insurance carriers, they don't look at things quite like that.
Right.
It's the medium, small size broker. In your case, you're a pretty good large firm, but you're still taking to heart what needs to be done for the client.
We're actually bringing to the table solutions that the big consulting firms can do, but typically don't do.
They don't want to be bothered with it.
I can't tell you how many groups of 2,000 and 3,000 I know of that are with one of the big name box house consulting firms. They don't even shop the groups out. It's literally criminal that they're getting away with this. But people think they need them. They think they need an army. All they're doing is overpaying for all their benefits. They're harming their employees. They're not really meeting their fiduciary duty to protect them with things like the prescription drugs. They're not shopping it out adequately and doing what they should do. So we bring all those solutions to the table. And I can just tell you that we normally get every group we quote on.
Yeah,
I'm not just saying that.
I would imagine you do.
And the thing I would say is it's all about the data. If you will give us the data we need. The other thing we don't do what the consulting firm, big firms do. We don't make you sign a contract saying that you'll go with us no matter what and pay us. We'll just do our work, and you can choose to go with us or not. We live off the merits of our work. And we normally win every time.
No, it's a great solution. If you want information, you're fascinated, you're intrigued with what you're hearing here, can they really make a difference? Well, you're not going to know if you don't reach out to them. So if you want to contact John, 314-494-7860, 314-494-7860. If you're on the podcast or looking on YouTube, the website is across the bottom of the screen. You can look at that as well. We'll be right back after the break. We're going to get in the weeds a little bit now and talk about some of the other things that they do on the financial planning side and some of the others. Stay tuned. We'll be right back after the break here on America's Healthcare Advocate. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast here across the USA. If you want help or information, go to the website, americashealthcareadvocate.com. Send me an email. I am happy to help you. My producer today, Mr. Garner Cowdery, Mr. Dave Thiessen, doing a wonderful job, as they always do, broadcasting here out of our studios in Overland Park, Kansas. My guests in studio today, John Kuhlmann, the founder and CEO of Kuhlmann Group. Lauren Broyles, she's the senior VP that does all the real work behind the scenes that John doesn't do. And financial advisor, Josh Bowman, who's going to talk today about the financial advisor services they offer through Kuhlmann Group. So, people are listening to this and they're going, well, we were told associations couldn't offer health benefits. Right. We were told associations couldn't have health benefits. Right. And I'm not saying that's not true, but there are ways to make this work especially like talk about some of the associations. I mean, you've got over 750,000 people that you are working with us on the gig care program on right now, offered through PSM Nebraska, our standalone. And if they're willing to be a consumer data respondent, they have access to this large group plan. Talk about how people access that if they're like, well, can we do that?
Yeah. So the big thing is even if you have an association plan now, a group plan for your groups and associations, the problem with it typically is after the first year or two, what you typically see happen is the groups that are in it that are sick stay, and then the healthy groups leave because they can find insurance cheaper on their own.
It's called the death spiral.
Yeah, and that's just very typical of what associations have happened. So we do things differently. And basically what we do is we bring in a solution like gig care for the individuals that want to go on to the gig care program, wonderful program. And then we also bring to the table group plans, but we broker that out. We consult with each group depending upon their size on the health insurance and on the groups. And we broker that out with the different companies. And we check every company that's available in the market for where that group is located and headquartered. We also do it on all the ancillary coverages. We also provide financial advisory, including 401ks and pensions. And one of the innovative things we do is we have a PEP program when it's appropriate, and we can show that to members. But we typically evaluate everything, even on that, and all their options on the 401k to look at. And then we have Josh to work with on individual financial advisory and other things.
So Josh, talk about what you do and your role here in terms of financial advisor. We talked before the show, and you're actually helping members. Let's say you've got a member on an association and he's turning 65 or 66, or she's turning 65, 66. They've had a 401k. They've got money sitting there. Now they're going to retire. What do I do with it? How do I invest it? This market's all over the place, up 400 points one day, down 1,000 another. I know because I'm in it. So how do you handle that in addition to the 401ks, Josh?
Yeah, absolutely. How do we retire and stay retired, right?
I like that.
It's kind of the key there. And generally, we'll just assess a few key risks of running out of money and how can we make sure that that doesn't occur in your spin down. Also, there's often questions around estate and handoff, legacy. It's all complementary to the 401k and the qualified plans. And at Kuhlmann Group, we're just really trying to bring a collaborative service right into the mix. We don't want to just be pigeonholed into one area. So a lot of times it's just kind of assessing those key risks. One being inflation. How do we keep up? Generally, the answer is the market. But that's uncomfortable, right? So we place sometimes market-based solutions, but then we've got to have some level of cash or guaranteed position that isn't going to be fluctuating in bad markets. Generally, the third one is the risk of a long-term healthcare event. We say it's a flip of a coin, 50-50, right? You or your spouse, and generally, you're going to have something. If you don't have a plan, the state has a plan for you, so we generally like to have control as well. And then the last one is the one that makes everything else worse. It's just longevity. People live. So
go to that long-term care thing for a second, because I'm going to throw an interesting statistic at you. How many people in this country, let's see if any of you can answer this, have long-term care insurance? Give me a percentage.
I would guess less than 10%.
It is less than 10%. You got it 100% correct. Now, I'm one of the ones that has had long-term care since he was 45 years old, okay? And Lori and I still have that same plan in place. But the point is, and you touched on that if you don't have a long-term care plan, you're going on Medicaid or you're eating into your estate to pay for long-term care. So that's interesting that you touched on that. So talk a little bit about what are they looking at cost-wise if they don't have a long-term care plan to be in a halfway decent facility, not a Medicaid facility where there's two people to a room, one shared television and a bathroom they both get to share. That's a lot of fun, I'm sure. Okay, and the first thing you notice when you walk in the door is the smell of Pine Sol.
Sure.
You know you're in a Medicaid facility. Talk about what it means to get into a decent private facility.
Yeah, so I did a lot of studying on this. I actually pursued a credential specifically in long-term care. And the reason is because it's a huge issue. There used to be a lot of companies in the space. There's
Not now.
Now there's about 11.
Right.
And I certainly wouldn't sell all 11, right? When we step into that space. So you've got to be careful in evaluating that and not overpaying. But there's generally, not to get too specific here, but there's generally 3 ways to solve it. One is you just take cash and put it on the sidelines, invest it, but it's protected. That's the most expensive way, right? Two would be some level of kind of basic long-term care. You use it or lose it. You pay for it, just kind of like car insurance. We don't hope that we get in an accident, right? Yeah. But if we do, we're sure glad we have it. And the third is some sort of hybrid where we'll use
life insurance to buy long-term care.
And so what the best option is generally dependent upon the individual and their circumstance. But
so give me an average cost that you see for a decent long-term care facility. Now, I'll tell you what my benefit is after you do that.
Yeah, so the average cost, and it depends on your state.
Yeah.
In the state of Missouri, around St. Louis, is about $4,500 a month.
That's right.
And that's the average, right? So if you have a more skilled nursing type facility, it's going to be well in excess of that. Memory care is, I think, maybe the most expensive.
It is. Yeah.
And generally we'll see that close to $10,000 a month.
Yeah. So my benefit right now is $300 a day, and Lori says $300 a day, which wouldn't cover the cost of what he's talking about. It's gone up every year. Not the policy's gone up, but not every year. But the benefit has held, and we're very fortunate to have it. And luckily, we're in decent financial shape that if there was a difference, we could pay for it. The problem is it's less than 10%. What's interesting is, John, you're doing this as an association manager. How many people out there do you think even know this is going to be an issue? Or they think, Medicare is going to pay for this. I don't have to pay for it.
Most people, from my experience, don't think about it. They don't even think about it, though.
Yeah.
A lot of people don't even have a will. One of the first things we talk to people about is basically, do you have your estate set up properly? And, just making sure that everything's proper. It's everything we do is really individualized to each customer, whether it be an individual, their needs. It's their individual needs. We want to make sure those are all covered properly. It's not peddling products or pushing stuff. It's about helping people doing the right thing. We do the same thing with the groups. Doesn't matter if you're a group of 2 or if you're a group of 5,000, anything in between. We're going to do that on everything we do, on every line of coverage or every product or service.
But you're able to, if again, people are listening to this all over the country. They're watching on the YouTube channel or on the podcast, and they're going, well, we have an association, but we don't do any of that. And you gave that story earlier about membership declining and how when you turned it back around, the associations have to be able to offer a reason for somebody to be there, right?
Right.
And that's what you're helping them do.
We drive that value. We're basically bringing Fortune 500 type benefit solutions, complete benefit solutions to a small group and medium-sized groups. Doesn't matter the size of your group. We're going to do all we can to provide the best value for all your benefits, unlike they've ever seen before with any other firm.
Yeah, you've got a commitment to excellence in customer
Again,
service.
we have a passion for it. We truly care about our customers. I guess you could say we're old school. Yeah. We do what we say we're going to do.
At 76 years of age, to read something, there's nothing wrong with old school, folks.
Yeah.
Okay.
Well, I'm 60, so I'm with you.
You got a long way to go, pal. You're very young. And then we have these two over here that are
the youngsters.
Very youngsters, absolutely. If you want information, you want to reach out to John, maybe you'd like to explore some of this. The way to do it is to give him a call, 314-494-7860, 314-494-7860. There's a reason he's on here today, and it's to educate you. That's why we do these shows, to educate you on what you can do to help yourself. If you're in an association, you want to start an association, whatever the case may be, these people are experts, and they're happy to help you. And if you're an employer with a small group or a large group, they're right there, okay? And they're offering solutions you're not going to find on a lot of the large carriers. So it's significantly different the way they do it. Once again, the phone number, 314-494-7860. When we come back from the break, I'm going to talk about what do you do if you've got W-2 employees, but you've also got 1099 employees? We'll talk about that. Stay tuned. We'll be right back after the break here on America's Healthcare Advocate, broadcasting coast to coast across the USA. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. If you've got a question, send me an email, americashealthcareadvocate.com. We're happy to answer all of them. And thanks to all of you in the listening audience. As I said in the opening monologue, 608,000 people viewing that podcast on YouTube. It's kind of surprising, but we do thank all of you. In studio with me today, John Kuhlmann of the Kuhlmann Group. Also, Lauren Broyles, who is his Vice President of Operations, and Josh Bowman, who is a financial advisor. We're talking about how they deal with not only groups, but association, because they're uniquely positioned to help association. He's got 750,000 people on association plans right now. They're working with us over at Datego on the gig care program through our population science management platform. These are things they're doing that are innovative. You're not seeing it out there from other brokers. So let's just start with that. I've got a company. It's a trucking company. They've got 4,000 drivers. 400 of those are 1099. They had no benefits for them. Right. Okay, you can't put them on health insurance plans, okay, because they're 1099. They came to us. We put the gig care plan in place. They put together a little bonus program to kind of offset the cost with their drivers based on the number of miles they drove. They were thrilled because all of a sudden the drivers had health benefits, okay, through the gig care program. So talk about how you deal with companies that have a double-sided payroll, like a 1099 and W-2, John.
So I would add with the gig care, not only do they have benefits, but they have quality benefits that are affordable. You know, we had our other podcast that we did about the NHRA, and Kenny Delco, our driver of the gig care car, he basically explained how one of his good friends, his ACA rates were going to go up to $2,700.
Oh, I remember this. Yeah.
And through gig care, he can cover himself and his wife for $1,290 instead of $2,700 and really have quality, better program. So we have that available, the gig care program, and we always look at that for every association to put it in place for them. Or if there's a company that has 1099 people that aren't covered, we look at adding that for them to drive that value to help their members out. Because if they don't help them, some of them may have to leave to go elsewhere. I know from a lot of our clients, we have several trucking companies that they have trouble retaining their drivers because they're competing against Amazon and all the other big companies. So they have to offer those benefits, and that's where gig care is a wonderful solution if they do have W-2 and 1099 drivers, right? But that's any company that has that. We can do that for any company. It doesn't have to be trucking. But we also have a group carrier that it's a TPA. TPA stands for Third Party Administrator, and they will insure 1099 members. Now, when you insure a 1099 member on a group plan, you cannot contribute towards the cost of their insurance to keep it separate, right?
Correct.
Because you can't have that employee-employer relationship. Right. So the member will have to pay for the cost of their insurance, but they are just another class of employees within the group plan. It's very, very powerful. It works really well. And typically that carrier, that TPA is really one of the best TPAs in the country. They offer great solutions. They do things to keep the cost of healthcare down. We have a lot of groups with them that are going on their third year with no rate increase at all. And one of the groups actually got a rate decrease in their third year.
That's highly unusual.
Yeah, it's totally unusual, right? And we still shop them out, right? Yeah. Even though that they're getting that, we still shop them out to make sure that they're getting the best value for the dollar, because healthcare is the second or third most expensive line item, like I said, that any company has. So
Lauren, you know, I was talking to somebody the other day, and we were talking about customer service, and he said, Carrie, the word service has gone out of customer service. I know you guys, you get to handle all that.
Yes,
okay?
yes.
Yeah. So talk about your approach to customer service, how it's different, and how when it's not if, it's when they have a claims problem, because inevitably a hospital codes a visit wrong, they do this, they do that, and then somebody gets a balanced bill. So talk about how you deal with customer service issues, Lauren.
Absolutely. So we definitely pride ourselves in our customer service. If you're a business owner, especially, you're working 24/7 around the clock. When 5 o'clock hits, our phones don't stop ringing. So we're around the clock service, because when you do have a problem, it is an emergency. Like you're saying, with a claims problem, we answer, we don't.
You're there to help solve the problem.
Yeah, when there's an emergency, we're here to help solve the problem, and we're here to help you get to the right person to solve your problem. So we're answering around the clock on the weekends, believe it or not.
That's amazing.
Yes.
Yeah, try doing that at one of the major carriers, folks, and see what you get, okay? Not going to happen.
Not going to happen.
That's one of the reasons why you are successful at what you do, is because you've got people like Lauren.
Exactly.
There has to be personal care for these folks.
Yeah, Lauren is, she has the work ethic of somebody who's 40 or 50 years old. She literally...
And she's only 19, so
she's only 19.
Remarkable.
She sure looks 19, so... But yeah, no, she is absolutely amazing, and one of the reasons why we just don't lose clients is because of our customer service. We have most of the clients that we've ever picked up from 36 years ago, and keep them. And then the ones we add, we keep them too. The only time we really ever lose a client is when they get bought out by another company.
Typically.
And the new owner comes in and just gives it to their guy. Yeah. We just don't lose it normally on any type of issue. We've never had a customer service issue.
So we're wrapping up here. We got about 2 minutes left in the show. what message you want to give to people that may be considering, hey, I've got an association, we've got membership issues, we have no health benefits. What do you want to say to them, John?
So we bring a complete package of benefits to all the members for everything that they may have from a needs standpoint. And we literally look at everything tailored to their needs, right? Unlike most associations that'll just try to put in like a group plan for groups, we literally look at group options, but they're the individual group options for each group, no matter the size. And same thing for individuals. And then we have Josh to help out with any type of advisory stuff too.
They're kind of one step above the basic benefit would be the deferred compensation, right? This is the conversation about attraction and retention. Those are both important pieces of key employees, right? And so how do we make sure somebody doesn't leave? And this is a whole thread to pull on, right? How do we make sure somebody doesn't leave, but we also don't give up equity or control in our company? What's that middle ground? And that's something that we're working a lot on, especially at the Kuhlmann Group.
Well, that's how you keep good people.
Yeah.
You go through all the trouble to get somebody that's really good,
right.
And the guy down the street says, hey, you know what? I'll give you 20% more if you come down here. When you lose those people, I just saw this morning that Berkshire Hathaway is losing one of the number one people. They're going over to Morgan Stanley. So even the big guys lose them.
Really painful.
Okay.
So what we typically tell new groups when we start working with them is that we usually can save them 20 to 35% off of their health insurance premiums. That's just that. The ancillary, it's very common. It's about the same number. We can't guarantee it, right? But that is typically the value that we drive. We do the same thing again on the ancillary. Usually we are driving better benefits at a substantial savings. Then we're usually able to keep those premiums level and flat. No matter what, we're always going to do what we should do to keep your benefits as strong as we can for your group.
I don't put people on this show I don't believe in. I don't put people and products on this show that I don't use or I don't service. These people work with us at Tatego. They are using our gig care program through population science management. They offer a host of other solutions. If you're in any way interested in what they can do, if you're an association, a small group, a large group, reach out to them and they would be happy to help you. You can call John at 314-494-7860. 314-494-7860. Thank you, all three of you, for doing this. We'll have to do some more of these.
Sounds great, Gary. Thank you for having us.
And now I leave you with this thought from Albert Einstein. The one who follows the crowd will usually get no further than the crowd. The one who walks alone is likely to find himself in places no one has ever been. Remember, friends, it's a funny thing about life. If you refuse to accept anything but the very best, you most often get it. Thank you for listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. Goodbye, America.